All right, get ready to explore, because today we're taking a deep dive into cerebral edema.
You mean brain swelling?
Exactly. We're dissecting this medical journal article all about managing it.
Yeah, and it's a big one.
Huge, especially in neurocritical care.
No kidding.
And let's be real,
What's that?
cerebral edema. It's not exactly a walk in the park, right?
Definitely not a term you want to Google before bed.
Right. It's basically swelling in the brain, but we're talking way more serious than just, like, bumping your head.
Way more. It's a major player after a serious head injury or a stroke, that kind of
And
thing.
the heavy hitters.
And it all boils down to pressure.
Oh, here we go with the pressure again. The brain doesn't exactly have a ton of wiggle room in there.
Nope, not much at all. The skull isn't exactly flexible.
It's not known for its flexibility. Okay, so walk me through it. How does this whole pressure thing work in the brain?
Okay, so imagine this is your skull.
Okay.
It's like a sturdy box, right?
Mm.
And inside, you've got your brain tissue,
Right.
blood vessels, cerebrospinal fluid, all the important stuff.
The VIPs.
Exactly. Now, picture a balloon inside that box.
A balloon.
Yeah, and that balloon, that represents your brain's ability to handle pressure changes, what we call intracranial compliance.
So the balloon is like the brain's shock absorber.
Exactly.
Okay, I'm with you.
Now, when there's swelling, it's like someone starts pumping more air into that balloon.
Uh-oh.
Initially, the box, your skull, it can handle it, but if the swelling keeps going, that pressure inside, it skyrockets.
And that's when we get into trouble, because there's nowhere for that pressure to go.
Exactly. The brain has no escape route.
Claustrophobia city.
It can get bad fast.
And that's an understatement.
Yeah.
That visual really makes you realize just how, I don't know, fragile this whole system is.
It is. It really is.
Now, the article talks about different types of cerebral edema, so it's not just one size fits all.
Oh, no, not at all.
Like, what are the main types?
Well, one of them is vasogenic edema.
Vasogenic edema, break that down.
Okay, think of it like a leaky pipe.
A leaky pipe.
Yeah. You see, we have the blood-brain barrier.
Right.
It's this incredible system that keeps things separate.
Like a gatekeeper.
Exactly. But when it's damaged, fluid from your blood vessels, it starts seeping into the brain tissue.
And that obviously causes problems.
Big problems. It makes the brain swell up.
Okay, so where do we usually see this vasogenic edema pop up?
It's common with brain tumors, infections like abscesses, even really severe high blood pressure can cause it.
Really? High blood pressure, too.
Yeah, it can lead to something called posterior reversible encephalopathy syndrome.
Catchy name.
I know, right? PRES for sure.
GRES, got it.
Yeah,
So it's not always about something you did to your head. It could be a side effect of something else going on.
exactly.
Wild. And then we have cytotoxic edema. Is that right?
That's the other one, cytotoxic.
Cytotoxic.
Yeah.
That sounds a bit more intense.
It's definitely different.
What makes it different from the leaky pipe situation?
This one's all about the cells themselves.
Oh, so we've zoomed in.
We've zoomed in. It's not about leaky pipes. It's more like those tiny pumps within the cells malfunction.
Malfunctioning pumps.
Yeah, they can't maintain the right balance of fluids and electrolytes anymore. So what happens? The cells swell up with water.
They just can't get enough, can they?
Oh. So what would you say causes those cellular pumps to go haywire?
Well, based on what we've talked about so far, I'm guessing it's not good.
You'd be right. A classic culprit is a lack of oxygen to the brain.
Like during a stroke.
Exactly. You see it with stroke, liver failure, some toxins, even prolonged seizures can cause it.
Wow, so many things can disrupt those little pumps.
It's a delicate system.
That's an understatement. This reminds me of that case in the article, the 58-year-old woman.
Yeah.
I think it was case 11.
Yeah, I remember that one.
She had both types of edema, right?
She did. She really did. Which just goes to show it's not always clear cut.
A mixed bag of edema.
Exactly. She came in with severe PRES. Remember that one?
The high blood pressure one.
Yep. And usually that points to vasogenic edema.
Makes sense.
Even her brain scans showed those classic signs.
Which are?
That swelling, it was mostly concentrated in the white matter of the brain.
So they're looking at the location of the swelling, too.
Oh, yeah. It's all clues.
Fascinating. So far, so good. But then what happened?
Well, here's the thing. She also had areas of cytotoxic edema.
A double whammy.
Exactly. Probably from prolonged seizures, the doctors thought.
Oh, man. Talk about adding insult to injury.
It just goes to show these cases can get really complicated.
Complicated is an understatement. It makes you wonder, how much can doctors actually tell just from looking at those imaging scans?
A lot, actually. It's pretty remarkable.
Really?
Yeah, they're like detectives piecing together a puzzle.
The case of the edema.
The pattern of the swelling, it gives them vital clues.
Like what?
Well, like what type of edema they're dealing with, which then points them toward the best treatment.
So it's not just about spotting the swelling, it's about understanding what that swelling means.
Exactly. It's all about interpretation.
Mind-blowing. Which, speaking of treatment, brings us to the million-dollar question. How do you actually treat this? Now, this is where I found the article got really interesting.
Oh, yeah. What'd you think?
They talk about a tiered approach to treatment, which to me sounds way more, I don't know, organized than just throwing everything at the problem and seeing what sticks.
Oh, absolutely. It's way more strategic than that.
Sure.
It's much more systematic and logical.
Oh, step by step.
They lay it all out in Table 1-2 of the article.
Always gotta love a good table.
Right. But they really emphasize starting with the basics.
Back to basics, the foundation. But what does that even mean when we're talking about the brain? It's not like we can just tell it to chill out, right?
You'd be surprised, actually.
Really?
It's all about making sure the patient is breathing properly, managing their blood pressure.
Keeping an eye on the vitals.
Exactly. Making sure their temperature is stable, all that good stuff.
The stuff that often gets overlooked.
It seems so basic, but it makes a world of difference.
It's amazing how much those seemingly small things can impact the brain.
It's all connected.
So it's all about minimizing any additional stress on the already overwhelmed brain.
Precisely. For example, something as simple as a fever can have a huge impact on brain swelling, believe it or not.
I wouldn't have thought of that.
So controlling those things, even if they seem minor, can really make a difference.
Wow, I'm learning so much today. So let's say those basic interventions aren't cutting it.
Okay.
What's next on our tiered approach?
Well, we start climbing the ladder, looking at medications that can help reduce that swelling.
The big guns.
Yeah, you could say that.
Bring in the reinforcements.
That's where things like osmotic therapy come into play.
Osmotic therapy. I feel like I've heard of that, but remind me.
Yeah, it sounds kind of sci-fi, right?
It does, a little bit.
But basically, they use salt to draw out the excess fluid.
Wait, really? Like table salt?
Not exactly table salt, but yeah, that's the gist.
That's wild.
The two big players are mannitol and hypertonic saline.
Mannitol, hypertonic saline. I'm writing this down.
Basically, they make the blood a bit saltier.
Okay.
And that difference in salt concentration, it pulls the excess fluid out of the brain.
So it's like a reverse magnet for water.
You got it.
That's amazing. So is it like choosing between, I don't know, Coke or Pepsi? Or are there reasons to use one over the other?
It's definitely not that simple, unfortunately.
Figures. There are always caveats.
Both mannitol and hypertonic saline can be effective.
Okay.
But the choice really depends,
On what?
the specific situation, what other health conditions the patient might have,
Right. Yeah.
even how they're responding to the initial treatment, all that.
So many factors.
It's all about personalized medicine these days.
Makes sense. But I can't help but wonder, messing with the salt balance in your body like that, there's got to be some risks, right?
You're right to be thinking that way.
Right.
It's a powerful tool, and like any tool, it needs to be used carefully.
Too much of a good thing and all that.
Exactly. You don't want to disrupt the body's salt balance too much, or else
What?
you end up with a whole other set of problems.
Oh, no. Like what? Give me the scary details.
Well, the article mentioned something called rebound edema.
Rebound edema. That sounds ominous.
It's not great.
What is it?
It's kind of ironic, actually. It's when, you're trying to reduce swelling with something like mannitol,
Right.
but it actually backfires.
No way.
Yeah, it makes the swelling worse once the medication wears off.
So the cure is worse than the disease. How does that even happen?
The brain, it likes to maintain a certain balance.
It likes things just so.
Exactly, like a seesaw trying to stay level.
Okay, I get the analogy.
When you introduce something like mannitol, it disrupts that balance,
Rocks the boat.
and the brain, it tries to compensate.
So it's like it's overcorrecting.
In a way, yeah. It's like the brain saying, hey, someone's taking away my water supply. I better hold on to extra, just in case.
Sneaky brain.
Right. And then, when you stop the medication, the brain is left with too much fluid, and bam, you got rebound edema.
That's brutal.
Correct.
Speaking of brutal, wasn't there a case in the article about this? Something about a 26-year-old guy, I think? Case 1-2, maybe?
Oh, yeah, that one was tough.
That was the one where they weren't monitoring his, what was it?
His osmolality.
Right, his osmolality. What even is that, by the way?
It's basically the balance of fluids and particles in the blood.
Okay, so it's all connected.
It really is, and this case really highlighted how important it is to get that balance right.
So what happened with the 26-year-old guy?
Well, he was admitted with liver failure, so he already had some brain swelling going on.
Not a great starting point.
Not at all. And then during dialysis, the medical team, well, they weren't as careful as they should have been with monitoring his osmolality.
And what happened?
His condition, it just tanked.
Oh, no.
Yeah, his pupils became fixed and dilated. He stopped responding.
Just like that.
It turned out his brain swelling, it had just gotten way worse, way too fast because of the rapid fluid shifts during the dialysis.
That's terrifying that such a small thing could have such huge consequences. But they caught it. Right. They were able to reverse it.
They were, thankfully, but it took aggressive intervention with hypertonic saline to bring his salt balance back to a safe level.
Intense. So it's a delicate dance, this whole edema thing?
It really is. There's not a one-size-fits-all solution.
And you definitely don't want to mess with the brain salt balance.
Definitely not. Speaking of things you don't want to mess with, let's talk about brain herniation for a second.
Oh boy, here we go. Brain herniation. That sounds like the title of a horror movie.
It's not pretty.
Lay it on me.
It's basically when the pressure inside the skull gets so high.
We've talked about that pressure.
Right. Well, when it gets that high, parts of the brain can actually be squeezed through openings in the skull.
Wait, what?
Or against other structures in there.
You're kidding. So it's like the brain is trying to escape.
In a way, yeah, it's desperate for more room.
And this happens because of the edema.
Exactly. When there's that much swelling, there's nowhere else for the brain to go.
This is why we can't have nice things.
The type of herniation, it depends on where the pressure is the highest, and where the brain has the least resistance.
So it's not all herniations are created equal.
Unfortunately not.
And they're all bad, right? Like, what can doctors even do in that situation?
Well, it depends how severe it is, what's causing it, that sort of thing.
Right.
But usually it requires pretty immediate and aggressive intervention.
We're talking serious stuff now.
Yeah, we're talking medications to reduce fluid, maybe surgery to remove whatever's causing the pressure.
Okay.
And in some cases, they might even have to remove a part of the skull itself.
Wait, hold up. Remove a part of the skull. Are you serious?
Sounds crazy, right? But it can be life-saving.
How does that even work?
It's called a decompressive craniectomy.
Decompressive craniectomy. Sounds intense.
It is, but it basically gives the brain more room to swell.
So instead of being crushed, it can expand outward.
Exactly. It relieves the pressure, prevents further damage, hopefully.
Wow. Talk about thinking outside the box, or I guess inside the skull. That's usually a last resort kind of thing, right?
Oh, absolutely.
But it just goes to show, even in those dire situations, there are options.
There are, but like we've been saying, time is of the essence.
Time is brain. Isn't that what they say?
They do, and it's true. And, it's not just about reacting to a crisis.
It's about preventing it in the first place.
Now you're on the right track.
Prevention is key. So what's on the horizon for treating cerebral edema? Anything new and exciting in the works?
This article touches on a really cool new area of research, the brain's own waste clearance system.
Hold on. The brain has its own cleaning crew.
It does.
I had no idea.
It's called the glymphatic system.
The glymphatic system. That sounds important.
Yeah. It is. It seems obvious, right? That the brain would have some way of taking out the garbage.
Right, you'd think so.
But we've only really discovered how it works recently.
No way. So what is this glymphatic system and how does it work?
Okay, so picture this. It's like a plumbing system.
Okay.
It runs alongside your blood vessels, and it flushes out waste products from the brain.
So it's like a brain drain, but for bad stuff.
Exactly. And
Yeah.
get this. It's most active when you're sleeping.
Ah, so that's why sleep is so important. I knew it.
It's not just about feeling rested. It's about giving your brain a chance to clean house.
Wow, I'm never going to feel bad about sleeping in again. So this glymphatic system, what's it used to clean up?
Well, the star of the show is cerebrospinal fluid, CSF.
Wait, the stuff they check with a spinal tap?
The one and only. It's not just there to cushion the brain, though.
It has more than one job.
Oh, yeah, it's crucial for this cleaning process, too.
Multitasking CSF.
And here's where it all ties back to cerebral edema.
Okay, I'm listening.
Researchers think that problems with the glymphatic system...
Like when the cleaning crew is on strike.
Exactly. They think it might be a big reason why swelling happens in the brain in the first place.
So if the garbage collectors aren't doing their job, the brain gets backed up, and that causes swelling.
You got it. It's all connected.
My mind is blown. And this is all new research.
Relatively new, yeah, which is exciting.
It's like we're learning something new about the brain every day.
Pretty much. And remember we talked about amyloid beta before?
The sticky brain plaque stuff.
That's the one. Well, guess what's responsible for clearing that out of the brain?
Don't tell me. The glymphatic system?
Bingo! And when it's not working right, that amyloid beta can build up, which causes inflammation.
And inflammation leads to.
Swelling.
It's a vicious cycle.
It really is, which is why this glymphatic system is so important.
So if we could figure out a way to boost this cleaning crew, we could potentially prevent edema in the first place.
Now you're thinking like a scientist. That's exactly what researchers are so excited about.
So how do we boost this brain cleaning crew? Can I just, pay them more? Where do we sign up?
If only it were that easy.
Right.
Researchers are looking into it, though, and it's pretty amazing stuff.
What kind of stuff?
Well, they're looking at lifestyle changes, potential drug targets, all sorts of things.
Okay, so first things first. What can people do in their everyday lives to help out their glymphatic system?
You know all those things your doctor's always on your case about.
Don't tell me.
Sleep, exercise, diet.
Ugh, those.
Those are the ones. Turns out they're not just good for your body,
They're good for the brain, too.
especially for that brain cleaning crew we've been talking about.
I knew there was a reason I loved sleeping so much. But seriously, are we talking about, major life overhauls here?
It doesn't have to be anything crazy.
Okay, good.
Even just making sure you're getting enough sleep and, good quality sleep, it can make a big difference.
Makes sense. What about exercise?
Even moderate activity can help get that glymphatic system going.
So I don't have to become a marathon runner.
Nope, just get moving.
Got it. And diet. Don't tell me I had to give up sugar.
Let's just say feeding your brain a healthy diet is always a good idea.
No surprise there.
Yeah.
So all things in moderation, including moderation, right?
You got it. But here's the really cool part.
Okay.
Beyond those lifestyle changes,
Yeah.
researchers are looking at ways to give the glymphatic system a more direct boost.
Direct boost. Now that's what I'm talking about.
Right. And one of the most exciting avenues is through potential drug targets.
So medication that can, specifically target this brain cleaning system.
You got it.
Shut the front door. This is amazing.
Right. And one of the most promising targets is something called AQP4.
AQP4. That sounds like something out of Star Wars. What is that?
It stands for aquaporin 4.
Aquaporin 4. Say that 5 times fast.
I know, right?
So what is it? What does it do?
It's a type of water channel found in the brain.
Water channel. What are we, plumbers now?
Kind of. Think of it like a tiny gatekeeper on the surface of brain cells. It regulates the flow of water in and out.
So it's controlling the water levels in the brain.
Exactly. And it turns out AQP4 plays a key role in how cerebrospinal fluid, that CSF we were talking about, how it moves through the brain.
And that's important for the whole cleaning process, right?
Exactly. So researchers are thinking if we can control these AQP4 channels
We could control the flow of CSF.
and potentially control swelling.
This is revolutionary. This is like brain plumbing.
It is pretty wild. And there are some promising leads. There's this drug called glyburide.
Glyburide. I've heard of that, I think.
It's actually a diabetes medication.
Wait, really?
Yeah, but researchers discovered that it can also act on these AQP4 channels.
Whoa, a 2-for-1 deal. So we might be able to repurpose a diabetes drug to treat brain swelling.
That's the hope. There have been some small trials with encouraging results.
No way. What did they find?
It seems like glyburide might be able to reduce brain swelling in stroke patients.
That's incredible. Are they prescribing it for that yet?
Not quite yet. We need more research, larger trials, you know the drill.
Right. Got to make sure it's safe and all that.
Exactly. But it's a great example of how these discoveries can open up a whole new world of possibilities.
Totally. We're not just trying to mask the symptoms anymore. We're talking about really addressing the problem.
Exactly. We could enhance the brain's natural ability to heal itself.
Now that's what I'm talking about. So it's not just about glyburide then.
Oh, no, not at all. There are all sorts of potential targets being explored, all focused on different parts of this glymphatic system.
It's like a whole new world of brain research.
It really is. And it could change how we treat so many neurological conditions, not just cerebral edema.
This is mind-blowing. So much to think about, so much to learn.
Yeah.
It's a lot to take in. But this article did a great job of breaking down that tiered treatment approach for cerebral edema.
It's a good one.
It really is. So if you had to leave our listener with just one key takeaway from all of this, what would it be?
I think the biggest thing to remember is that cerebral edema, it's not a one-size-fits-all kind of thing.
Right. Everyone's different.
Exactly. And it's not static either. What works for one person might not work for another, and what works at one time might need to change as the situation evolves.
So it's all about being adaptable.
Precisely. You got to be paying attention, be ready to adjust the treatment as needed.
No resting on your laurels in neurocritical care.
Definitely not. And that requires a lot of vigilance from the medical team. careful monitoring,
And communication.
especially communication between the doctors, the patient, their family. Everyone's got to be in the loop.
That's why it's so important for people to be proactive.
Absolutely.
Ask questions to really understand what's going on.
Knowledge is power, right? Especially in a situation like this.
Couldn't agree more. Well, this has been quite the deep dive. Thank you so much for walking us through all the ins and outs of cerebral edema today.
My pleasure. It's always fun to nerd out about the brain.
I've learned so much.
Yeah.
And to everyone listening, thanks for joining us on this journey into the complexities of the brain. Until next time, stay curious.